We're now live. You can proceed.
Thank you for joining us today. I'm David Rabbit, Supervisor for Sonoma County's 2nd District, and this is our COVID-19 update for Wednesday, September 8th. Let's begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa organizada por el supervisor David Rabbit y la doctora Mace. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con supervisor David Rabbit.
Thank you, Gilbert. Appreciate that. The good news to share this week is that Sonoma County residents are now 75% fully vaccinated. That represents great progress, and the number continues to grow at a rate of about 1% per week. This is encouraging. Another 8% of our population is now partially vaccinated, which means just 17% of our eligible population has yet to receive at least one dose of the vaccine. The other encouraging news is that our COVID case rate has continued to stabilize or decline after a surge this summer. But as we move into fall and winter, we need to stay vigilant. No one wants a repeat of what we went through last winter, the darkest days of the pandemic. The overall case rate now is 19 per day per 100,000 residents, but broken down by vaccination status, it's 39.6 per day per 100,000 residents for unvaccinated individuals and 7.9 in the vaccinated population. So this is another way to demonstrate how effective the vaccine really is. Our local numbers alone show that Sonoma County residents are 5 times more likely to get COVID virus if they are unvaccinated. We'll dive deeper into the case rates as well as provide updates on the latest health orders. But first, I'd like to turn it over to our Sonoma County's health officer, Dr. Sundari Mace, for an overview of the current state of the pandemic. Dr. Mace?
Great. Thank you so much, Supervisor Rabbit. Since there continues to be many questions about the new school year, we want to start with an update on COVID in schools. As of this week, there have been 235 COVID-19 cases in Sonoma County schools since classes started in August. That represents 121 cases in elementary schools, 41 cases in middle schools, and 72 cases in high schools. Of these cases, 215 have occurred in students and 20 are in staff members. Our data shows that 7 exposures are linked to school sports. On Friday, I issued new guidance for youth sports. This includes a requirement to wear masks indoors for all athletes, coaches, staff, and spectators, regardless of vaccination status. Masks are required for both competition and practice during physical education, conditioning, weightlifting, and other indoor activities. COVID-19 vaccinations are strongly recommended for all participants who are old enough to be eligible for vaccination, as well as for coaches, staff, and volunteers. Having all athletes and staff fully vaccinated will greatly decrease the risk of transmission of the virus amongst teammates and between teams, and it'll provide excellent protection against severe illness, hospitalization, and death. Vaccinations will also decrease disruption in team activities, since fully vaccinated individuals are not required to quarantine if they're close contacts to a case of COVID-19. We know that the virus spreads in congregate settings, so anything that we can do to make those settings safer will help limit the spread. This week, I also issued a health order that requires inmates at the county detention facilities to be tested for COVID-19 upon entry. Detention facilities are particularly high-risk congregate settings because of the close quarters. Inmates are exposed to many different staff and volunteers while in jail and may be required to move among different living modules, thereby increasing the possibility of COVID-19 transmission. The inmate population is at substantial risk of severe illness, even if fully vaccinated, because they may have certain health conditions that make them vulnerable to severe consequences of COVID-19. As we have done since the beginning of this pandemic, we will continue to monitor the data, the situation, and take steps needed to keep the community safe. Another measure that we took last week is a health order that requires home health care workers and pharmacists to show proof of vaccination or submit to regular testing if unvaccinated. This aligns these important workers with vaccine and testing requirements already in place from the state for other healthcare workers, as well as teachers, and the local order for emergency personnel and for other county workers through an HR policy. I'd now like to turn it over to Dr. Irma Shende, Sonoma County's vaccine chief, for more on the vaccine campaign.
Thank you, Dr. Mace. As Supervisor Rabbit said, we continue to make great progress in our vaccination campaign. And as of today, more than 75% of our eligible population has been fully vaccinated against COVID-19. An additional 8% are partially vaccinated. We continue to reach out to the roughly 15% of the population that has not had a single dose of the vaccine yet. It's critical that everyone get vaccinated, especially at this time, before what could be another surge in cases this winter. We also anticipate booster shots and vaccines for children under 12 to be available sometime this winter, so vaccine supplies could be stretched thin. As of now, the vaccine is widely available. Apart from most healthcare providers and pharmacies, you can get free vaccine at any number of county-supported pop-up sites and clinics. A full schedule of vaccine clinics in Sonoma County can be found at socoemergency.org/vaccine. Now I'd like to turn it over to Dr. Leslie Kimura to talk about COVID testing, which is in high demand right now. Dr. Kimura?
Thank you, Dr. Shende. Testing has increased by 88% just in the past month. The demand for testing in our area is at levels that we haven't seen since last winter when our COVID cases were peaking. The county has responded to this heightened demand by increasing testing capacity from 1,000 tests per week to 17,000 tests per week. This includes the addition of 2 5-days-a-week curative clinics at Bluebird Center in Windsor and Rohnert Park Community Center starting next week. In addition, LHI is opening new single-day clinics on Mondays at Monte Rio Community Center and Tuesdays at Petaluma Valley Baptist Church. It's critical for you to know that you have multiple testing options every day in Sonoma County. To find out where these testing clinics are and how to sign up, and if they allow walk-in appointments, visit socoemergency.org/test. And I'll share my screen now so that we can look at that site together. So here on the website, you can see that this is our testing landing page on the SoCo Emergency website in the COVID section.
Dr. Kumar, we don't see your screen yet.
Oh. Thank you. Can you see my screen now?
Yes, we can see now. Yeah.
Great. So now this is the SoCo Emergency website testing landing page. Here, if you scroll down and expand this plus sign, you can see a calendar of events. If you click on this link here, you can see the different days laid out based on the month and the different testing options that are available for the day of the week. You can also search by testing provider, and here are 4 different providers that we partner with. In addition, you can find a testing location near you based on location within the county, and each of these sections are expandable, and you can see the different locations within there. And finally, there's a map that you can look at that has the different testing options. If you click on the site, it will show you the site that's available. So as you know, demand for testing is high, and each site has different recommendations and policies regarding walk-in appointments. So for example, some sites, such as those at the Foundry Wharf in Petaluma, require an appointment, while Roseland Community Center, for example, only accepts walk-in clients. Others, such as those operated by Curative and LHI, accept walk-ins, but it's highly recommended that you get an appointment. If you need expert help to navigate your many testing options, please call the Sonoma County hotline at 565-4667. Making an appointment is the best way to avoid long lines at testing sites. You can also schedule a COVID test through your primary healthcare provider. Now I'd like to hand it over to Kate Pack from the county's epidemiology team, who will share some new data about the pandemic on the county's website. Kate?
Yeah, thank you, Dr. Kimura. Let's see, I'm going to share my screen. Having a little trouble pulling the window up. Wait one moment. Okay. So today I just wanted to provide a brief orientation to some of the data resources that are available that track COVID-19 cases, vaccinations, deaths, hospitalizations, and hospital capacity. And most of these resources are updated on a daily basis. And I wanted to introduce some new features that we have available, as well as some upcoming features that you can anticipate. To start with, we'll look here. These boxes represent our different dashboards. So COVID-19 case data includes case and testing information, tests conducted per day. We'll look at this in more depth first. We also have a dashboard that's dedicated to vaccination data, who's getting vaccinated, what vaccination rates are by different regions of the county, a hospital capacity dashboard that's updated daily to help you understand numbers of COVID-19 hospitalizations, staffing, availability of ventilators, and hospital beds. So we will begin here. So looking at the landing page of the cases dashboard, you'll see these boxes up at the top that indicate current numbers of active cases, cumulative numbers of deaths, cumulative numbers of recovered cases, and total cases that we've had in the county. This is the last 24 hours. This chart is showing the case rate, so the number of cases per 100,000 residents by vaccination status. So this orange line is showing the number of cases per 100,000 per day among those who are unvaccinated, and the blue line is showing the same among vaccinated residents. Scrolling down, you can see, looking since January, the number of new cases reported by date. Looking at the same time period, you can see total cases by date, recovered, deaths, and active cases over time. And if you wish to see for any of these charts, if you wish to see the full data set for the entire pandemic, you can click on these boxes and open that up. Down here, something new that's been added is we have folded the information about testing volume into this page. So you can see here the average number of tests conducted per 100,000 population. And this is with a 7-day lag. And you can see that currently we're at 656 tests per 100,000. And looking here at our tests conducted per day over time, you can see that we are reaching testing volumes similar to those that we saw in the winter surge. And scrolling back up, if you click up here, there's a new metrics and trends page that's been added. And so this page is nice for an at-a-glance understanding of where we are. So looking at our overall case rate, so number of cases per 100,000 residents per day, we're at 18.2. And then you can look at that same case rate by vaccination status. So currently today, we're at 39.8 among unvaccinated, 7.9 among vaccinated. Looking at our test positivity, overall, we're at 3.7% in the lowest quartile of the Healthy Places Index. So those areas of the county where residents tend to have less access to resources to support health and well-being, we see slightly higher testing positivity at 4.6%. Although California no longer is utilizing the blueprint for a safer economy, we thought that it would be helpful to leave this framework here just for help as a frame of reference in interpreting where we are with our data trends. And so you can see these lines on these charts representing where the cutoff is for purple tier, which indicates widespread transmission, tier 2, which the red tier, former red tier, and the orange tier. And so this first chart is showing trends in our case rate over the past 14 days with a 7-day lag. And so you can see this encouraging trend that we seem to be decreasing in our cases. This chart is showing new cases per 100,000 per day over the entire pandemic. So you can see here's our winter surge, here's the recent surge we experienced. And I wanted to point out that these charts are interactive. So if you wish to zoom in on any period, you can use this slider and look more closely at any section of data. Testing positivity also shown over the last 14 days, as well as over the entire pandemic. Also seeing an encouraging downward trend there. And then for health equity, which I mentioned above, so understanding what positivity is looking like in the lowest quartile of that Healthy Places Index, you can see that we're seeing a similar trend of an increase, and then we're beginning to decline again. Okay. Now, we'll just move here to the next tab. This is looking at our hospitalizations and deaths by race, ethnicity. So you can see here, for each racial ethnic group, the proportion of the population, and then the relative proportion of deaths over all time and proportion of hospitalizations. So for example, if we were looking for Latinx here, we can see that while representing 27.3% of the population, this group has represented 42.3% of hospitalizations, showing a disproportionate impact. You can also see hospitalizations and deaths by age group. Again, this is cumulative. And then breakdowns by facility. Earlier in the pandemic, we saw quite a few deaths among the SNFs and RCFEs before the vaccinations were introduced. And then this is a timeline of the COVID-19 deaths. And so here, again, you can use this slider to look at deaths over all time or zoom into more recent trends. We have seen 46 deaths just since July 1st. And I wanted to note that on this page, we will be adding additional information soon that breaks down hospitalizations and deaths by vaccination status. So that is a feature to look for soon. You can also look at cases by age group. This is looking at Sonoma County cases by age group over all time, and then looking at it by age group over the past 60 days. So you can see as compared to over all time, we've seen a slight increase here in cases among the 5 to 17-year-old age group. Just a slight increase there, and the less than 5. And then we continue to see a majority of cases occurring in, and I apologize that this writing is a little bit small. You can always zoom in as well. I'll try to do that here. So you can see among those 25 to 34 and 35 to 44, a majority of the cases. Okay. And coming back up, we can go and look at race and ethnicity. And this is looking at the table shows proportion again of population by racial ethnic group and then proportion of cases, which is one way of understanding, and then the actual cumulative number of cases, which is one way of looking at disproportionate impact. Another way of understanding that is looking at case rates. So again, taking population size into account and then looking at rate of cases per 100,000 population. And so you can see that here, and you see the guide here that shows that over all time, you can see that the Latinx community was more disproportionately impacted than any other racial ethnic group. And you can see, looking up here, that this group also experienced the highest number of cases of any group, with over 17,000. Then we also are including trends over the past 60 days. So same here, that you can see proportion and the proportion of the population, the actual number of cases experienced in the past 60 days. And then again, looking at case rate per 100,000. And so when you look at case rate, you can see that relative to population size, Black, African American, shown here in the yellow, and American Indian Alaskan Natives have experienced a disproportionate number of cases. If you want to see how many actual cases that is, you can refer to this table above. And then the zip code region page is something that we've had for a while through the pandemic, but you can look at, again, this is taking population size into account by zip code to understand which zip codes are experiencing the highest active case rate. So the highest number of cases per 100,000 population. And so you can see that either in this chart or by the map. And the darker blue is representing where we're seeing a higher case rate. And if you click, let me demonstrate, you can pull that up. Okay, so for example, here for Santa Rosa in 95407, you can see the total number of active cases is 315, and then the total number of cases over all time, which is 5,800. And so you can kind of get some information about what's currently going on, as well as what has been seen throughout the pandemic. The source page is looking at what are we seeing in terms of where cases are coming from. So you can see the guide down here. The blue is representing workplace exposures. Light pink is small gatherings, so gatherings with 12 or less people, gatherings with more than 12 people, large gatherings, household transmission. You can also see healthcare settings, travel, congregate care, and other primarily consists of community transmission. So for example, if someone went to a bar or a restaurant, that might be included there. This light blue is indicating the proportion of cases for which we didn't have enough information to make a definitive determination of where that infection occurred. So you can see here, this is active cases as compared to cases 30 to 44 days ago. As compared to all time, we're still seeing a majority of cases through household transmission, followed by gatherings and work site transmission. However, if you scroll down, you can see here among cases where we know where the infection occurred, this is the proportion of cases due to large and small gatherings. And this top line is the total. So if you add together those small gatherings and large gatherings, what proportion is due to gatherings. And you can see that we've seen a decrease as summer has wrapped up. We'll need to keep an eye to see how Labor Day gatherings may change this or not. Down here, you can see by occupation group over all time, and then in the past 60 days, what cases we've seen by occupational sector, and then how many of those cases were due to transmission at the workplace. And so this is showing the proportion of cases in any given sector over all time that was due to transmission in the workplace. So for example, if we scroll down and look at the past 60 days, and we look at sales and services, we can see that 80 of the 374 cases, or 21%, were due to transmission on the job. We also will be adding another chart here shortly that's going to show kind of a timeline visual of where we've seen exposure events. So beyond just occupational sector, the kinds of areas in which we've seen exposure events, whether those are, for example, like SNFs and RCSCs, as well as some of the occupational sectors, but I think it'll be a useful visual for kind of showing the trends we've seen and the size of outbreaks that we've seen across different areas. So, and then we have a page that's looking at our tracking of variants and post-vaccination cases. So you can see here, and again, it's important to recognize that not all testing samples can be tested for variants. So this is a selected sample out of all cases in our county, but that we can see that cumulatively through our local resources as well as state and federal testing, we've seen 557 instances of Delta, and the variants of concern and variants of interest follow CDC guidelines as what's defined as a variant of concern and interest. And there's resources here if you wish to know more about how those designations are made. We also track post-vaccination cases. So you can see here that since vaccination started in Sonoma County, there's been about 2,500 cases of COVID-19 in residents who are fully vaccinated. That represents less than 1% of all fully vaccinated residents in the county, and about almost 17% of all total cases that we've had in the county since January. And then you can see here breakdowns of these post-vaccine cases by age, race, ethnicity, and sex. So that is the cases dashboard. If you wish to know more about vaccines, you can click up here. You can see an overview of our status. So how many doses has Sonoma County administered? And again, this is updated daily. And then you can see how many residents are partially vaccinated, fully vaccinated, and of those 12 plus, how many have been partially vaccinated, fully vaccinated. And as Dr. Shende mentioned earlier, we are at 75% currently of the vaccine eligible population. You can see on this page the number of vaccine doses administered by provider, and you can see that either in this form or in a table form. You can look at vaccination status by looking at proportion of each racial ethnic group vaccinated, proportion of each age group vaccinated, and also look by sex in terms of partial and full vaccination. This page, the region zip code, helps us to understand what proportion of vaccines are going to residents in the lowest quartile of the Healthy Places Index. We see here that 26% of all doses have gone to residents in this region. And we can see here that 72% of residents in quartile 1 are at least partially vaccinated, with 65% fully vaccinated. This chart shows the proportion of residents 12 plus vaccinated by zip code. You can also look at a map that indicates the proportion vaccinated by color. So purple indicates a smaller proportion has been at least partially vaccinated. Green indicates more people have, and you can see the same information organized by zip code. And then finally, I wanted to show you the hospital capacity dashboard, which is updated daily. Let it load. So you can see the proportion of ICU beds that we have available. This is adjusted per state guidelines to account for the proportion of ICU patients who are COVID positive. So currently almost 45% of everyone in the ICU is COVID positive. So the number of ICU beds that we have available is adjusted downwards to account for that. And there's more information about how that's adjusted in this footnote. We have 14 out of 63 staffed non-surge and surge ICU beds available, currently using no surge beds. 68% of the 75 ventilators across our hospitals with EDs are currently available. And then this chart is showing a benchmark that the state had introduced earlier, which is that we should try to stay above 15% capacity in terms of our ICU availability, 15% availability. You can see that recently we did dip below that, but are coming back up towards that 15% mark. And the purple line is indicating regional ICU availability. So other Bay Area counties. This chart in the dark blue, this represents patients who are COVID positive. The light blue represents patients who are in the ICU for other reasons. So you can see that the proportion of ICU patients that are COVID positive has increased since this low we were experiencing in April through June. And our COVID-19 hospitalizations, and it's worth noting that this chart is tracking not just COVID positive hospitalizations, but also influenza hospitalizations represented in blue, and then COVID and influenza together. We've had very few instances of influenza and no instances of COVID influenza combined. But again, you can use this slider to look at some of the more recent trends. And you can see that while hospitalizations remain elevated, we have seen a slight decrease from what we were seeing a couple weeks ago. Okay, and we'll stop sharing screen.
Okay. Thank you, Kate, for all that. Thank you for walking us through all that important information. We just want to remind everybody, reiterate that all of this information is available on the county emergency website, which is socoemergency.org. That's SOCO emergency.org. And this information is available, and all this data is available in both English and Spanish on that website. So we want to thank everybody, all of our panelists, for participating in our COVID update for Wednesday, September 8th. We also want to remind everyone that this information will be provided tomorrow at 4 o'clock in Spanish. And we encourage you all to join us again next Wednesday at 4 p.m. for another COVID update that time. So until then, stay safe.